Hey YouTube friends, do you suspect that you might have a rotator cuff tear? Are you having trouble picking up your arm? Or maybe you've already been told by a doctor or physician and you had an MRI and you were told that you have a rotator cuff tear. Well, the next question that patients often have is, can a rotator cuff tear heal naturally without surgery? Real quick, my name is Dr. David Middaugh. I'm a specialist physical therapist over at Paso Manual Physical Therapy. I've been helping out people with rotator cuff tear problems for years, mainly helping people avoid them. Of course, we do see people here and there that have had a rotator cuff surgery because it's necessary in some cases. But what we've found is that in about 9 out of 10 cases, it is completely possible to avoid having a surgery and allow your rotator cuff tear to heal naturally and get back that full motion with your arm, the strength to pick up things again, and lying on that shoulder without having to worry that you're going to be waking up at night all the time. This week has been packed with new patients, and 3 of the patients that we got this week have asked us some version of the same question that is something like, can a rotator cuff tear heal naturally without surgery? And with each and every one of them, we emphatically said, yes, it can. And we see it happen here in the clinic all the time. We get people that have a diagnosed rotator cuff tear. They've got their MRI report that shows they've got some tear of some sort. And they're considering having surgery for this because that's what most people in the medical field push patients with rotator cuff tears to do. But they end up coming to us for a second opinion to see if it's possible to avoid surgery so that they can get their shoulder motion back again and be able to sleep on that side and stop taking pain medications, avoid injections, get their shoulder back. And the cool thing about this is there's research evidence, there's medical literature, medical research evidence out there that is supporting this. There's more and more research coming out gradually over the years where they've compared people that have had surgery and how they recover after the surgery, and people that have avoided surgery and gone through conservative treatment, which is physical therapy pretty much. And they've found that 6 months and even up to a year later, they're all improved about the same amount. So this begs the question, is a surgery for rotator cuff tear even necessary? So we still have yet to find out exactly what type of rotator cuff tear absolutely needs surgery. As far as research goes, we don't have a clear-cut example or a clear-cut algorithm or step-by-step process to figure out who really needs surgery and who doesn't. And what the medical field at large has done is just kind of overestimated and said, well, you have a tear, go get it operated on. But what we're finding more and more in the research and in clinic experience is that many people can get better without it. Let me tell you an example of a patient that we had just this past summer. We had a client who came in who was scheduled to have a rotator cuff surgery 2 weeks out from when we saw her. Of course, she couldn't pick up her arm. It was hurting her. She said it felt like a toothache in her shoulder. If she moved it in just the right position, usually when she moved her hand outwards or reached all the way out, or if she picked up something heavy. In her case, she loves to garden and do active stuff out in the yard and at home. She takes care of her home quite a bit. And so every time she had to go do something that involved some sort of strenuous force with her arm, she would feel that shoulder bite her right away. I mean, it was even down to when she was cutting vegetables, a harder vegetable like a carrot or something like that. If she had to push the knife down through a harder vegetable like that, it would hurt and jolt her shoulder at times. As we began treatment and saw her improve, she gradually began to get more motions back, was able to hold more heavier things in her arm, able to use her arm in more forceful ways. And part of her treatment required us to take her into even weightlifting with that shoulder. We actually did overhead weightlifting. That was what she needed to do. And we did it in such a way that was not aggravating the rotator cuff tear. And the timing is important as well. We can't just start like that. We have to work up to being able to do overhead weightlifting. So it is completely possible. We see patients here all the time. That's one example of many. I can think of another one we had in December. She was a CrossFitter and has done many exercises with her shoulders. She loved to row. She was also scheduled for surgery and ended up postponing it in the hopes that we would help her out, and we did. So she ended up completely canceling her surgery for her rotator cuff tear. She was so happy about it. She was so glad that she could avoid it. And most importantly, we got her back to doing all the exercises that she was doing before with no shoulder problems. So if you're out there and you've got a rotator cuff tear, you think that you might have a rotator cuff tear because you've researched it, it sounds like you have one. You're probably wondering, well, what do I do next? How can I begin to solve this problem naturally without having surgery so that I can get back to doing everything I want? Well, let me tell you the next best 3 steps that you need to take right now. Number 1, go get a sling. Like the type of sling that you might get in a hospital or an urgent care clinic if you hurt your shoulder or your arm. They sell them at Walmart, at CVS, at Walgreens, even grocery stores have them. It's the type of a sling that you just put your elbow into. It's got cloth that, like a cloth sling that you put your elbow into, and then it's got a strap that comes around your shoulder over your neck and connects to the other end of the cloth sling by your hand. And what you want to do is tighten that up so that it shoves your shoulder up towards your head. You want it to be kind of firmly pressed up there, not too uncomfortable in case it's starting to hurt more, but it should feel like it's pressed up against your body and up against your head decently well. And the point of that is to take pressure off the ball and socket joint where the rotator cuff tear is. The rotator cuff muscles and tendons hold the ball up against the socket. So the weight of your arm just hanging with gravity can tension that tear. And so if you get that sling on and shove it all the way up, it takes that tension off the tear and can allow you to feel a little bit better in the short term, but also to begin the tendon healing. The tendon sometimes isn't fully tear, it's just a partial tear. And if you ever have an MRI, they'll talk about that, a full thickness tear, partial thickness tear. You can get into all those details, but what you want is to bring those edges of the tear together so that they have a chance at healing. So that sling is a big deal. Now, just because you're in a sling doesn't mean you have to be in it all the time. You're looking at getting into it when you're most active. So whenever you're doing chores around the house, or maybe if your workplace is kind of busy, you want to put it on there. Obviously, if you have a very, very active job and you need your arm for just about everything, you might not be working right now. But you want to have that sling on. Also, just for other people to know that you're not able to do things, because if you're not wearing a sling and you have a rotator cuff tear, you usually can do things with your arm nearby that don't require a whole lot of force. But if you go to do something more strenuous, then you'll hurt that shoulder, and you don't want to be aggravating that shoulder constantly because you can make that tear worse. So if you have that sling on, it communicates to people around you immediately that you can't do certain things with that arm, so they are going to be more inclined to help you, and you'll kind of get away with not using your arm more. Now, that being said, think of the second tip that I'm going to give you here. You need to use your arm in ways that don't hurt it. So you don't want to completely stop using your arm just because you're in a sling now. And by the way, you don't want to have that sling on all the time. Just put it on at times when you feel like you need it. But do use your arm. If you can brush your teeth with your arm, do that. If you can reach your head or do your hair, do that. You know, in the shower, clean yourself up. Small things around the house, like cooking, cleaning, your laundry. Do things that you can do without your shoulder hurting. You're going to have to slow down. You're going to have to pay attention. And you really, really want to avoid aggravating it, because every time you do, it's kind of like picking at a scab. You know, if you cut your skin on your hand and over time you develop a scab, well, it's going to be tender if you press on it, of course, but if you go start picking at that scab and peel it off, it's going to start bleeding, and you have to go through that healing process all over again. So you don't get a scab in your shoulder, but a similar healing process happens. And whenever you go to do something that just kind of is on the edge of pain, it's kind of like pressing on a scab. You're not going to set yourself back, but you found where it hurts. But if you do something that just forces your way through some pain, and it hurts for some time afterwards. I mean, you're hurting for days afterwards because of that thing that you did. You picked up that real heavy thing. We had one client that came in this week that said that he felt the tear when he went into the back of his truck to pick up a heavy toolbox up over the tailgate, just like so. And that's when he felt a rip and pain that lasted for several weeks afterwards. And so that's probably where he tore his rotator cuff. Obviously, you don't want to do something like that. So you want to do the light things. But the movement's important, because then you allow the muscles around your shoulder to work and to stay healthy and to not fully weaken as much as they can if you don't do anything. So you want to maintain easy, simple movements that are not bothering you and not flaring you up for long periods of time. The third thing that you need to do is go find specialist help. Rotator cuff tears are no joke. They can easily go bad, and the last thing you want is to fully tear it and really make it so bad that you have to have surgery, because it's just a long recovery, and a lot of times people end up having another rotator cuff tear later on. But if you get some specialist help, somebody who can help you heal this rotator cuff problem naturally, then you're going to be in great shape, because they'll make sure that you're guided in your exercises, that you're guided in your routines. You know how to adjust your daily routine, your workplace, your ergonomics at home, at work, so that your shoulder isn't bothering you day to day, and you know that it's getting better day to day. That is priceless, because then you can have that confidence and that peace of mind that your shoulder is going to heal, and you're not going to have to go under a surgeon's knife to make that happen. And I want you to know that it is possible in 9 out of 10 cases from what we've seen here in the clinic to get back to doing everything you were doing before. I mean, push-ups, lifting weight up overhead, being able to do all the yard work you want, being able to pick up heavy things. Your shoulder should be able to heal. The body is super resilient. Tendons are excellent at healing given the right environment. Other tissues in the area are really good at healing, but we've got to find, as a specialist physical therapist that helps people out like this, I can tell you we've got to find the root problems, which the rotator cuff tear itself is never the root problem. There's always some shoulder blade issue, some neck issue, some muscle imbalance problem that needs to be addressed in order to set up the rotator cuff tear to heal fully. And that's just not something that surgeons do or that physicians do. Their specialty is in medicines and in surgery, which is fantastic if you need it, of course. But if we're looking to fix the root problem of a rotator cuff tear so that it's not happening to you again and you're not having to rely on surgery, medications, injections, then talking to a specialist physical therapist that can treat the root of the problem is what you need to do next. Hey, so if you thought this video was helpful for you, please give us a like down here. If you know somebody that needs to see this video, please share this with them. You're going to do them a huge favor so that they can have a chance at allowing their rotator cuff tear to heal naturally. And then also hit the subscribe button right over here so that you can get notified whenever we release new content that can help you be healthier throughout your life. Thanks so much for watching, guys. Have a great day. Bye-bye.